Yes, yes. So hello everybody. We'll speak about how to prevent and treat coronavirus, COVID-19 with beehive products mainly. My specialty is apitherapy. I know a lot on herbs, on essential oils and so on, but it's not my specialty. I'm also acupuncturist, so I'll try to make a synthesis and to give you the best of my knowledge. Okay, so let's share the screen, and first of all, okay, I'll show you directly my PowerPoint, and then maybe if we have time, I can show you my database. Okay, do you see my screen? Can you see my screen? Yes? With the drawings, with the bees? Yes. Okay, very good. Let me take out this video panel, and even this one, I'll try to do this one. Hide floating meeting. Okay, good. So you still see my screen, yes? Okay?
Yes, I can see. Yes, I can.
Okay, good. So let's start. We know that all beehive products, we have heard that they have antiviral properties. And I'll tell you what are the main substances which can destroy the virus from the bee products. Main ideas of this lecture, I'll give you an introduction, the main causes of COVID-19. We'll discuss also why beekeepers do not die of COVID-19, extremely seldom in comparison with the rest of the population, and what would be the main methods to prevent and treat with beehive products this disease. Okay, so we know from the literature, from our own experience, I'm using apitherapy for almost 30 years, and I gathered from all over the world a lot of books and journals, and I am in contact with over 1,000 apitherapy practitioners from all over the world, and all of them, they tell me that the beehive products are good for our body through many different mechanisms. And in the body, inside our body, one part of the body is the immune system. And the immune system, you'll see, can be helped also by all beehive products. And here it's interesting, one small detail. Honey, we have kept honey here, which is mature honey, which has less water. And here is not yet mature honey, which has still some water. And where is water, there is also lactobacillus. And the lactobacillus are very good for immune system. So when you use honey, it's good to use both kind of honeys. Okay, now there are over 100 scientific studies which shows that beehive products are good against viruses, antibacterial, anti-inflammatory. And you can see, you can just click on this link. Oh, by the way, let's make a test. Let's click on the link and see what is happening. Yes, you see my website now?
No.
You see?
No.
Is that Dr. Stang? Yes, sir. I can see that.
You see the scientific papers?
No. Back to your PowerPoint.
Okay. So it doesn't go with this one. Okay, so I'll go to the PowerPoint back. You see now the PowerPoint? You see the PowerPoint now?
Yes.
Okay, good. So you find in my website in apitherapy.com this over 100 scientific studies. You can download them. Here is one image. You can download this. You just click on each of these links, and you download the scientific paper. Okay, so then you can study at home. Now, all beehive products can be used, not only the main one like bee venom and so on. I make a small break here because I see that some people, they make noise. Please do not make noise. Okay, mute all. I'll mute you all. Okay, maybe now it's better. Okay. So high floating member. Okay. Now we can use not only pollen, bee venom, honey, propolis, or royal jelly. We can use to prevent and treat this disease also other bee products like bee bread, like Apitherapy, drone larvae, honeydew honey here, beehive air, which comes directly into the lungs, and also the beeswax. And you'll see it's very interesting the use of beeswax. Now, the main components in the beehive products which are helping against the virus are melittin from the bee venom. This is very, very powerful. It can destroy the virus with no problem if it's enough amount, good amount. Then polyphenols and organic acids we find in honey, honeydew honey, in propolis, in pollen, in bee bread. Essential amino acids and apalbumins, they are also antiviral, antibacterial, and so on. Stem cells in the drone larvae. And beeswax is very, very good for heat release. So, and the heat is good to help the immune system. So we have direct action against the virus and indirect action. And if you see here also, the bee products, they are very, very good for not only against the virus, but also for the body functioning. We have carbohydrates from honey, which gives the energy, polyphenols, which are antibacterial, and so on and so on. So nutrients, vitamins, enzymes like telomerase from pollen and bee bread. Telomerase, it's a very, very important enzyme for regeneration of the cells. Now, the question is, can the bee products really help the immune system? And my answer is clearly yes, because the beehive products are having many good characteristics. They are like baby food, like best nutrients, because they enter into the body with very, very small amount of energy, which is used to digest. For example, honey is pre-digested, is digested before by the bees. So we have here glucose and fructose, which are monomolecules, which goes very easy into the blood with no consumption of energy from our digestive tube. Same is for pollen, for bee bread, for royal jelly. We know that the queen from the bees, she eats all her lifetime only royal jelly, with only a few exceptions. So this food is digested before by the young bees. So such foods are very easy to digest. So they are like baby food. But also they have protective substances like antioxidants, also helping substances against all kinds of viruses and dangerous microorganisms. And also on top of this, very, very important, these beehive products helps the blood and lymph fluidity. This is a very important topic because when you get an infection, all of us normally, and not only us as Homo sapiens, as humans, but also the animals, even the fish, we have fever. So the body increases the body temperature, the nervous system, the immune system, the endocrine system, and so on, because higher temperature leads to a better blood and lymph fluidity. And when these two kind of components are more fluid, then the white blood cells, the immune system, can work much faster. Okay, so we have many, many different characteristics, many different properties which are helping the functioning of the immune system. Okay, now let's look to the statistics, worldwide statistics. We know that at least 95% of the world population is okay or have just temporary medical problems with COVID-19. So why only about 5% of the population have problems? Why only 5%? So it means two things, that this big part of the population, it's either not in contact with the virus, not yet in the contact, or it has a strong immune system and a strong body. And even if the virus comes, it cannot enter, or it is very quickly neutralized or eliminated. People which are having problems, usually they have other problems, not only the virus. They have the so-called comorbidities, which means diabetes, heart diseases, high blood pressure, You see problems in the capillaries, in the arteries, obesity, and so on. We'll discuss about this. Or they are very old people. So in order to treat and prevent COVID-19, you need to focus on this type of people and see why they have the problems. Okay, here is, I like very much the saying from Sun Tzu. He was a very famous Chinese who wrote a book, The Art of War, with many, many advices on how to lead a war. And he said one of the sayings was, know the enemy and know yourself. In 100 battles, you'll never be in peril. So the enemy is clearly the coronavirus. And ourself, our body, we must know very well the anatomy of the body, the physiology, which is the functioning of the body, the physiopathology, how the body acts in case of diseases. So we need to know as many as possible medical things. Now, let's start with the patient and her weaknesses. Why these people get the disease? One answer, general answer, is that they have different weaknesses, which leads to a low immune system. So the main cause of COVID-19, in my opinion, is the low, weak immune system, because if the immune system is strong, it will not allow the penetration of the virus in the body, okay? Even if we inhale the virus through the nose, or you get it through the mouth, or you get it through the hands, and then we touch the face, the nose. So even if the virus enters into the body, if the immune system is strong, it will eliminate it. So this is the major cause, in my opinion, and not the virus. Virus is just there. Virus can be also dangerous if it's very aggressive, but this coronavirus is not so aggressive. It's not like HIV or like Ebola or like SARS or like MERS. Okay, so the structure of the immune system, a few words about this. You can look in internet, you'll find a lot of thousands of articles on this. But basically, the immune system is like our own army, with soldiers, with police, and so on, which is all over the body. We have these ganglions, which is figured here in green, which are all over the body. And then we have these parts, these organs, like the bone marrow, red bone marrow here and here, and all the bones, especially the big bones, they have this red bone. And here is the factory where the immune system cells are made, the mobile cells, like the white blood cells. They are made here. And I make here a small introduction. Many people have problems with the immune system because their diet, their food is too sticky, too thick, like too much cheese, too much dairy products, too much meat, too much sweets. And the bone marrow does not receive a good quality blood. The blood is too thick and cannot come with oxygen here, and nutrients cannot clean the bones. So the white blood cells which are coming then enters into the immune system, they are from the very beginning, from the school or from the maternity if you want, they are weak. So you'll see to make happy all the structures of the immune system, you need to take care of a lot of different things. Here is the thymus, which is very important for the schooling of the lymphocytes. We have the tonsils behind the nose, on the throat. We have the spleen. We have these pear patches, which you see here in green, which are all around the digestive system. So how come this powerful immune system, which we have inherited for millions of years, can be damaged by various things? So what are these things? One of the main things is emotional stress. I start with this one because it comes from outside and attacks the body first of all. We know that when you have depression, our lungs function lower. When you have fear, our kidneys or the adrenal glands together, they function very bad. When you have hate, irascibility, we are nervous. Our liver cannot work properly. When you have too much worries, obsession, jealousy, our pancreas and the stomach gets in problem. When you have lack of joy, our brain and our heart doesn't work properly. And there are books, really good books, big books on neuropsychoimmunology, which says that when you have emotional problems, you create problem in the nervous system and also in the immune system. So anything which affects the whole body will affect also the immune system. So the same kind of emotional problems, they make problems in the immune system. Okay, so now let's see here some of the causes of this emotional stress during these times. We have now this time of social distancing. It is very true, and it was proven this already in the pandemia in 1918, 1718, when it was the Spanish flu. The social distancing is very good as a principle because the virus cannot go so easy among all these people. And I make a parenthesis here, brackets in permaculture compared with agriculture, intensive industrial agriculture. In industrial agriculture, you have crops on thousands and thousands of hectares, only one crop, only wheat or only corn. So the viruses, vegetal viruses, can go very quickly among all these plants. But when you do like in permaculture, you mix the plants, different plants, and you do not make a big mess of the same plant, then the viruses, bacteria, parasites cannot spread so easy. So distancing is okay, but the distancing, if it's not done properly, it can cause problems, emotional problems, because it causes depression, lack of joy, which gives hypoxia. Hypoxia means low oxygen, which leads to weak immune system. Fear, panic increases the suicide rates. Maybe you heard very shallowly in the television. They do not want to tell the truth to the population, so they don't tell about the suicide rates. Anger and hate, it causes fights in the family, traumas, the people which are fighting inside the family, because when you put in a closed space the people, when there is not enough love, you invade the space, personal space of another person, and then it starts fights and problems, which leads to high blood pressure, and high blood pressure leads to higher risk of brain strokes, and so on and so on. Depressed person has higher risk of cancer. Excessive worries leads to a higher consumption of sweets. When we are worried, we have a tendency to eat sweets. And if these sweets are bad sweets, like made with sugar, McDonald's type and Coca-Cola and Pepsi-Cola and so on, then we get diabetes. So we need to avoid all these emotions if we want to maintain a good body and if we want to have a good immune system. Okay, so as I said before, the anger makes high blood pressure and strokes, which means explosions in the brain. Fear, panic makes suicide. Worries and dominant ideas and obsessions like, oh, so many people died. You see on television only how many people died, but not how many people got cured. So you get all these kind of problems. So social isolation is okay, but it increases many negative problems. So we need a good psychotherapist. We need to practice meditation. We need to learn yoga, to learn relaxation, how to deal with these bad emotions. There are other causes of a low immune system, like physical stress, weather, climatic stress. For example, if it's too hot outside, too much wetness, too much rain, too much wind, too much coldness. Oh, sorry. I must again. Mute all. Okay. Okay, mute all. Okay. Yes. Okay. Okay. So. Good. Let's continue. So these climatic factors which are affecting the health also, and also we have the physical stress, like too much physical work, exhaustion. Okay. We have chemical stress, external pollutants, like here you see, but also internal pollutants like constipation, kidney infections, and so on. When we have constipation, we cannot eliminate mainly the fat-soluble toxins and residues from the whole body. When you have problems in the kidneys, like infection in the kidney, you see here inflammation and pus, then we cannot eliminate mainly the water-soluble toxins and residues. So these toxins will accumulate in the body and will create problems. If we have problems in the lungs, like we are smoking, or we live in a polluted environment like it was in Wuhan and or Lombardia in Italy or New York, any city which has a lot of pollution, has more problems because the lungs, which cannot function properly, cannot eliminate properly the volatile toxins, which are coming like from the example from alcohol or from large intestine, and also the mucus cannot be eliminated properly. We have disease of the skin like urticaria, psoriasis, eczema, and so on and so on. We cannot eliminate the fat-soluble toxins. We have also another kind of chemical stress, which is aggravated by the lack of water, because all the toxins we spoke above, if we have enough water, we can eliminate them through the kidneys, through the large intestine. Usually have no problems. But if you have also lack of oxygen, nothing can work in the body. The muscles need oxygen to eliminate the toxins. Or you have lack of nutrients or micronutrients, which are necessary for the structure of these organs, which are important in detox. Another stress is biological stress. If we have inside our body, besides the coronavirus, we have other kind of viruses or other bacteria which are in large numbers and they are pathogen, which means they are dangerous, okay? We may have parasites which are quiet, not dangerous, but sometimes they may be very dangerous. Or you have fungus or candida. Usually when it's large number, it's a problem. Another cause, lack of clean and well oxygenated air with enough negative aeroions. So this is a problem because we get a lot of energy from the air, not only from the food. So the air must be clean in our area. Another cause, poor blood flow. So if the blood doesn't flow properly, here is an example on the legs, then we get poor circulation, we get cold legs, and then we may get even gangrene or ulcers, or we have here edema. And such situations, if they are present in a patient, will affect also the immune system, because when it's a blockade in the blood flow, the immune system cannot cannot go all over the body. Insufficient or low quality sleep. If we have insomnia, we have any problems which does not allow a good sleep, then the nervous system and all the cells in the body cannot regenerate. That's why we need 8 hours of sleep usually, at least. Sometime if we are very, very good like yoga practitioners, we can have like 6 hours a day or less. But normal people, they need at least 8 hours of good quality sleep. Okay, so regeneration, remember, cannot happen if we don't have a good sleep. Another cause, it's advanced age, which is usually related to problems in the chromosomes. Inside, there are free radicals which are attacking the chromosomes, for example, oxidation, and also the problems with the telomeres. And if this happens in the vital organs, like we have heart diseases or lung disease or liver disease or kidney diseases, this goes together with DNA damages and shortening of the telomeres, excessive shortening of the telomeres. This goes to advanced or early aging. Okay, so you see here a good regeneration, like in the children. Why the children, when a child gets a cut, the healing or a bruise in children is very, very fast, because they have normal good chromosomes with long telomeres. See here, these are the telomeres. Okay, if the telomere, this part of the telomere is shortened, is affected by the age, by the free radicals, and so on and so on, then we cannot repair so easy. We cannot regenerate the damaged cells and tissues. That's why the old people, they need much more care. They need substances and things like from the youth, like more water, more vitamins, more telomerase to regenerate the telomeres, and so on and so on. Another problem which affects the immune system are these comorbidities that lead directly and indirectly to a poor functioning of the immune system too. So it's not only that the comorbidity, like heart problem, affects the heart, but also indirectly the heart problem affects the immune system, and then the immune system cannot fight the virus. Here in images, a few of these ideas like fatigue, pathogen microorganisms, smoking, lack of oxygen, poor diet, and so on. And you'll see that the causes of the low immune system are a lot of causes can affect our immune system. That is why treatment which is focused only on one direction, for example, you look only for the fatigue, but you do not take care of the other ones, you cannot really heal, or the healing is very slow. So here is, you see other causes: poor regeneration, internal external pollution, dehydration. And then you have capillary fragility, which is the main factor in COVID-19. So coldness, dehydration. So many causes are affecting the immune system. And now what is interesting, each of these causes, taken separately, can aggravate other causes. For example, if I have a poor diet, I have free radicals. For example, I eat fried food, fried potatoes, roasted seeds. Anything which is fried with too much fire will cause free radicals, and the free radicals affects the immune system. If I have, let's take another example, I have too much stress, I get constipation, and then I get internal pollution. If I have dehydration, I have sleep disorders, because no water in the brain, in the nervous system, the brain cannot function properly. So these causes, each of the causes gives other causes, like capillary fragility will be related to poor regeneration of the cells, not only the capillaries, and so on and so on. So you see, it's really very complex, and I made this study a couple of weeks ago. So it looks like very complex and very complicated. But the thing is that if you have enough patience, you can neutralize all of these causes step by step. So you need a treatment protocol. You need, first of all, to check on the patient. Does he or her has poor blood flow? Okay, has a poor diet, it is fatigue, or it is sleep disorder. So each of these causes, you look in internet, you ask the doctors, you ask the naturopathic doctors, and then you try to think, how can I best improve the diet? How can I best reduce the capillary fragility? How can I best eliminate the coldness, and so on and so on. So everything is possible, but you need to have a kind of Chinese patience and to look to all these factors, not only to one of them, okay? So now the other major cause of COVID-19, as I said, is these comorbidities, cardiovascular diseases, diabetes, and so on. And let's take them one by one. First of all, cardiovascular diseases. This is one of the major area. We know that most of the people, they die because of heart attacks all over the world. So it's more or less the number one cause of death. But in the case of COVID-19, if you have also too much cholesterol in the blood, then we have problems in the blood flow. Another big problem in the cardiovascular disease is when the vascular tissues, the arteries, the veins, the capillaries, the arterioles, and so on this, inside the arteries and heart, you have this layer of so-called endo, which means internal endothelial cells. And here is the problem. When the virus enters into the body inside, it goes through the blood vessels and attacks also these endothelial cells. And when it attacks these cells, it causes like breaks, it causes local like destruction, and this afterwards causes complications. Here is on the heart. When the virus attacks the heart, one part is it can attack this lineament, this internal lining of the heart, and it causes an endocarditis, or it can attack also the muscle of the heart too, and cause also heart attack. One of them, as I said, and I will repeat it many times during this presentation, in my opinion, the most important cause of COVID-19 is this capillary fragility. What does it mean? If you look to the arteries and arterioles and capillaries, they have a structure which is made by collagen. And collagen can be damaged if we do not have enough good substances. And then when this is damaged, it comes hemorrhages, microhemorrhages, which you can see like in this image. Sometimes we have bleeding from the gums even without a stressor. Like see, this kind of tool here is just showing where is the bleeding, but bleeding is everywhere. So if you have this kind of bleeding, it means that the capillaries are too weak, too fragile, okay? So this is caused by the lack of vitamin C usually, polyphenols, good quality nutrients, excessive sugar, free radicals, etc. And remember about scoreboot from the school, from the last centuries, when the sailors were on the seas for many months. And at that time, the bosses of the ships, they didn't give fruits and vegetables fresh to the sailors, because they said, oh, the fruits and vegetables will decay during a long trip. So the sailors have had lack of vitamin C, and the lack of vitamin C gives scoreboot. Scoreboot, it's with bleeding in the gums and all over the body if it's excessive. So vitamin C is fundamental if we want to treat COVID-19. No vitamin C, no real healing of the COVID-19 and all these immune system diseases. Here is an example. This bleeding goes to advanced periodontitis, then advanced periodontitis and parodontosis, because the bleeding attracts bacteria, then it comes inflammation, then the bacteria eats the gums here, the collagen, and then the teeth become mobile, and you lose the teeth like these young boys here, which drank too much Coca-Cola. Okay, so, but the same phenomenon happens all over the body. So here is on the teeth, but it can be in the liver, in the kidneys, everywhere, the same phenomenon. Okay, so again, I say that capillary fragility allows an easier penetration of the virus in the body. It creates a stronger inflammation, like with this cytokine cascade. It creates complications like thrombosis, because when it's a bleeding, the nervous system, the endocrine system, everything goes into a kind of panic, and the bleeding must be stopped as soon as possible. So it comes a thrombus, which blocks the leaking blood. So it causes finally thrombosis or microthrombosis in the lungs and everywhere in the body. It can create strokes and heart attacks. So capillary fragility, remember this. Okay, now another thing here, if we compare natural medicine with allopathic medicine. Allopathic medicine is the pharma industry leaded medicine. And this kind of capillary fragility cannot be treated with antibiotics. You cannot cure this thing with antibiotics, with cortisone, non-steroidal drugs, antivirals, any chemical drugs cannot heal this. No lung ventilators can heal this. On the contrary, they aggravate the problem, okay? But only healthy food supplements, vitamins, beehive products, medicinal plants, and so on, can really heal this thing, because it's a very, very deep problem, which involves thousands of different substances, and only one kind of substance like antibiotic or cortisone cannot heal really, okay? So another comorbidity, I said before, diabetes. If we have sedentarism, we stay too much in front of TV, we do not make exercise, we take too much sugar, we take too much dairy products, like too much cheese, then the blood will become thick, will become too sweet, and then we have problems in the pancreas, and we get in big trouble, because diabetes is also related to bleeding. You know, bleeding in the eyes, and the people, they are losing the eyesight, or bleeding in the legs, and they get ulcers, and so on. But the bee products, propolis, honey, you find a lot of studies in the internet, in literature, scientific literature, with the anti-diabetic effects of propolis and royal jelly, and even honey can be used against diabetes. And here are a few ideas, scientific things about diabetes. They found out that diabetes is related to COVID-19, okay? And diabetes lowers the immune system. There are many articles on this one. Another comorbidity, obesity. Obesity increases the risk of heart problems, the blood flow, and the nervous system. And so the immune system cannot function properly, because we have too much fat into the blood, and the immune system cannot travel easily into the blood. Okay, comorbidities like cancer can also affect the immune system, and in itself, cancer, it's a cause of death. So when a patient with cancer, it's an advanced stage of cancer, and it comes also the virus is just a favoring agent, is not the cause of death, okay? Other infections from other viruses, bacteria, fungi, or parasites can cause problems. So the people having too much other microorganisms which are bad will die because of these things too, not only about COVID-19. Another like comorbidity we discussed a bit, but this is separately taken. It's age, too old age, like over 65, 70, 80 years old. Normal people at this age, it's normal that they have more frequently a normal death. It's even biological death, normal natural death. Okay. And here, you know, the statistics you saw on television many times that mostly people ages over 65, they get COVID-19 with complications. Now, a big topic is, are beekeepers protected against COVID-19? If yes, why? And we started to ask people from many countries, and we'll send special questionnaires with questions to as many as possible beekeepers to get back this answer if they know cases with COVID-19 among beekeepers, especially death among beekeepers. And most of you are members in the WhatsApp group and our email groups and so on. And you know that we asked people from many countries. And at the end of the conference, the theoretical part, I will also kindly ask you to tell me if you heard about any cases with death with COVID-19. The reality is that beekeepers, until now, from all people I asked, from United States, Canada, Australia, Nepal, India, Sri Lanka, Oman, Germany, France, Spain, only 3 cases of death among beekeepers have been recorded, and three cases among thousands and thousands of beekeepers. It's a very low rate. But we'll have the good figures later in the coming months when we'll have these questionnaires with the answers. So why beekeepers have a lower rate of problem? Because they are happy people. Because they get bee stings, and bee stings activate the immune system. It activates the leukocytes, especially the lymphocytes, to destroy many antigens, many substances like from the venom, but also to destroy viruses, bacteria, and so on. When the immune system is strong, then it can get rid of many bad microorganisms. Okay, there another factor is the beekeepers, they have a higher better blood flow. And you see, they have a face usually which is more red than the rest of the population, which means a good blood flow, which means hyperthermia, which means like the body temperature is a bit higher than the rest of the population. Sorry. So, hyperthermia means an environment which is not good for the virus because the heat destroys the virus. And also a better blood flow means immune system flows the immune system cells travels very fast into the body. And there is another mechanism, I believe, here. When the beekeepers are stung by the bees, the bee sting destroys local cells and destroys also capillaries. But the body learns how to regenerate fast these lesions, these micro wounds, and learns how to keep the capillaries in good shape and strong and flexible. Okay, so there are many other characteristics. Of course, the beekeepers, they take honey, they take propolis, and they are better protected. So the lessons we need to take from the beekeepers is that it's good to have a frequent use of bee venom and all other main beehive products. It's good to stay as long as possible in the nature, and it's good to do like them, to learn constantly new things, and thus keep the brain and the immune system strong and healthy. So when you have COVID-19, look to your nearby beekeepers. Okay, now let's start to talk about the enemy, about the coronavirus. Now, there are many, many different types of viruses. There are hundreds, thousands of different viruses. And the human beings, like the mammals, like many other species all over the world, including the plants, the herbs, all life forms on the earth, have been attacked or are attacked and will be attacked by the viruses. So there are two things here. If the virus is very aggressive, like in case of Ebola or SARS or MERS, then there are problems. But it's another situation like coronavirus is not so aggressive, but it's very contagious. It's more contagious than the normal flu. So the other problem can be, besides aggressivity, too much number. Okay, so I'll tell you how to diminish both these things. Let's look to the structure of the virus. We have this spike glycoproteins, which are outside, and we have the main thing here, the Achilles heel of coronavirus. You know, here is the sculpture of Achilles. You remember from the history, they were able to kill Achilles, which was very, very strong fighter, by finding his spot, the weak spot. And the weak spot of this virus, weak spots, are the proteins. And we have proteins outside the virus and proteins inside the virus. This hemagglutinin esterase, M protein, E protein, RNA, and N protein. So there are many proteins inside the virus. Also, there are some fats, but the proteins are the main structure. Now, every time when you boil an egg, you destroy, you denaturate, you coagulate the proteins. So one very important topic here is that we can destroy the virus also with heat, not only with soap and disinfectants and so on. Let's see a bit how the virus enters into the body, into the cells. The theory says that the virus come and attach to special receptors. And like you see here, the virus, and here is the cell. There are receptors on the membrane of the cells, and the virus attaches to this receptor. And this receptor is called angiotensin converting enzyme 2 receptor. Some people, they do not say that's like a receptor, but it's anyway this kind of structure. And the virus comes and attaches here. And then when you have this phase, this is the aggressor, this is the cell, and then the virus can go through this mechanism. So it goes step by step into the cell, and when it enters into the cell, it starts to multiply, it causes a lot of damage, it causes free radicals. But here, one topic here, one thing here, is that we know that if the cells are strong, if they have interferon, which can attack the virus, if it has enough antioxidants, it can block the free radicals. If it has good energy and good substances, even if parts of the cell are destroyed, the cell can regenerate, okay? So sometimes the virus can stay in the cell and not destroy the cell, okay? So we have many possibilities to block this COVID-19, and if we can delay the multiplication of the virus in the cells and then elimination of the spread in the body, we allow time to the immune system to prepare the fight. It's like when it starts a war, you have these military people. If the war starts too quickly, then the military people from the Defense Department, they need time to prepare the strategy. So if they have enough time, they can make a good strategy. So anything which will delay the speed of penetration of the virus or multiplication in the body and spread in the body will allow the immune system to prepare the strategy and to create the weapons to destroy the virus. And here I give you a very nice model, like to remember better, is the key and lock principle. So the spike proteins are here, like they are like a key. And you see here, this one, the lock is like this receptor, angiotensin converting enzyme 2 receptor, okay? So this is the key and this is the receptor, this is the lock. So lock and key mechanism. The key can enter into the lock as long as it is perfectly adapted to the lock, and as long as the key is intact, okay? But what we can do to affect this thing, to destroy this mechanism, we need to either destroy the key, which is the virus here, these spike proteins, which allows the penetration into the lock, okay? Or we jam the lock itself. The jam means here this angiotensin receptor to be blocked. And there are blockers of this angiotensin receptor. So first here again, you block the key by heat, for example, or by organic acids. And then you block the receptor with substances like the ones from propolis, like quercetin, the polyphenols from medicinal plants, and so on. There are many natural remedies which can block this receptor or cover it partially and not allow the virus to enter so easy into the cells. Okay? So another thing about the COVID-19, we know already it's airborne. So there are many studies on this. So it comes through the air. And an interesting thing is from Japan, the virus goes outside through our sneezing, through big droplets from our sneezing, or when we speak loud. We also eliminate liquid droplets from our mouth. And in these droplets, viruses can be present. The big droplets are usually no problem because they fall down in about 1 meter, 1.5 meters distance, or 2 meters from where from our body. And then they are destroyed by the dryness, by the ultraviolets and so on. But the problem is with these micro droplets. Micro droplets, we can stay in the air for a long time. Okay, so here you have a schema. The droplets containing virus in the air can come into the nose, we can inhale, and we can get problems, as you already know. So the idea is we can block this spread of virus by sneezing into the elbow here, by having facial masks, by keeping a social distance, okay? By cleaning the surfaces, by not touching the face, and so on. You saw this hundreds of times on television, these kind of measures, okay? The trick is to destroy this virus before it enters the body, okay? Before its multiplication. How destroy the virus before entering? We have here several methods. Air ventilation, sunlight, ultraviolet, and so on. Actually, air ventilation. This was also recommended by the Japanese researchers. When we stay in the house, in the home, and somebody like one of our family members goes outside to buy goods, to buy food, and comes back possibly with a virus, if we have a good ventilation in the room, even if the virus goes into the air, it will very quickly eliminate it. So eliminate it or at least dilute it. So remember, when you have lower amount of virus, we have lower problem, lower aggressivity, okay? So another thing is that the ultraviolets, the direct sunlight, the ultraviolets destroy the viruses too. So it's a good idea to go as much as possible outside in the air, in the sunlight. Exposure to ultraviolet lamps in the hospitals, in the surgery rooms, they use these ultraviolet lamps, okay? And we can use it inside our homes, even infrared lamps. Some hotels, they use heat in the bathrooms, because in the bathrooms of the hotels, of course, it comes many microbes. So they clean not only with disinfectants, but also with the heat. Okay, also air purifying devices. There are many such things which you can put in the rooms. They have in the hospitals too, okay? But for us in apitherapy, the best is to combine heat and propolis in the devices which are called propolizers. And here is an example from Italy with Propolair, this kind of device. There are different forms, like this one, or like this one. They use the heat. This is electrical heat. And here is propolis in this part of the device, propolis. And then it's pure propolis, purified propolis with no wax inside. And then the heat, like in aromatherapy, will make these volatile substances to go into the air. The temperature here, it's very precise. It's like 80, 82 degrees Celsius, more or less. and it's not over 100 degrees Celsius. Attention, because if you put propolis on too strong heat, over 100 degrees Celsius, it can become toxic. Okay, so take care about this issue. Okay, so lower temperature 80, 82 are perfect. And the thing is, you should put Propolair in your living room, but also in the bedroom, as many as possible such devices, and also in your cars, because in the car you have a lot of pollutants from the car parts, like the chairs and so on, from the plastics from inside the car, especially when the car is new, but also pollutants from outside and also pollutants from the motor. And it was proven that the propolization of the air in the car can neutralize many of these toxins, benzene and so on and so on. And this is really very, very good. Another thing is that using Propolair in the cars makes the car a kind of treatment room, a kind of sauna. Let's say that you have a very, very clean car, and if we travel through a clean environment, like between cities in the countryside, then it's a good way to treat COVID-19. So it's a bit funny, but the patients with COVID-19 can stay inside such a small space because the concentration of volatiles from propolis will be larger in a small space. And also we have Propos steam from Slovenia. It's another kind of device which uses also the heat, electrical heat, and this makes the propolis to evaporate slowly, and this goes into the room and propolizes very well the air from the room and helps against the problems. Now, other chemical methods, soap, disinfectants, alcohol over 60%. And here I make a small detail. When we clean the hands with soaps, it's very, very good. We destroy the virus, no problem. Bacteria, we destroy them, it's clear. But too much soap may create problems in the skin of the hand. So one very good idea is to use propolis tincture, which has alcohol usually over 70%, sometimes 90%, 96%, and it has alcohol plus propolis. So when we put like spray of propolis or propolis tincture on the hands, the alcohol will evaporate quickly in less than 1 minute, and the propolis will stay on the hand, will create a layer of protection, and will also help the skin to stay healthier. Okay, acids also can denaturate or change the proteins. We know that when we eat meat or vegetal proteins, in our stomach where we have strong acids, chlorhydric acids, this damage the proteins together with the proteolytic enzymes. So these are the chemical methods. Unfortunately, these chemical methods are too strong. It's okay if a team like this one comes here, let's say 3 hours before, and all these chemical substances are more or less evaporated, neutralized. But if I come too quickly after this one, like I go into a field of intensive agriculture where they sprayed with insecticides, then I can get a lot of problems because I can get even cancer because of these chemicals. So we need to use not only chemical methods. This is okay for the cities, for the airports, for big spaces, factories and so on, but in our home, we should use mainly biochemical methods, which do not hurt the body structure and its healing powers. So beehive products, medicinal plants, essential oils, we should use daily to protect our body. Okay? Another method is here not only to have the propolis into the air all over the rooms, but also to breathe the propolis, to have a mask, breathing mask. So you get the propolis directly into the nose. So it's much more concentrated. Propolis is not lost in the room somewhere. You just breathe in, okay? So we have here Propolair from Italy, and here is Propostin from Slovenia as device. And I give you also another very, very good idea. You can do it at your home or in your beekeeping houses for beehive air therapy, but for medicinal purposes too. We have a colleague, a friend, very good in Romania, Alina Varadi, which is using the propolis into mini rooms. Excellent, brilliant idea, which is, you see here in this image, she made in her own shop in Cluj-Napoca in Romania, small rooms in wood, and it looks like this one from outside, from when you open the door. It's a table here, and it's like a hexagonal, like the form of the beehive. And then in each corner, almost each corner, she puts, or you can put also propolizer devices, propolizing devices for the room, but also to breathe in. Okay, so this is like a sauna, propolis sauna if you want, and you can go inside, read some books for 10-15 minutes, and then go out. Not stay too long, because if the propolis is too concentrated in some people, then it can create headaches. Okay, now let's go to the symptoms which are caused directly by the virus, to remember them. So how it enters through the nose, and we have the signs and symptoms: rhinorrhea, mucus, nasal obstruction, anosmia, which is lack of smell, sinusitis. It can go also to the brain, because from the nose is connected to the brain directly with the olfactive nerves. So it can cause headaches. And some people, they have headaches during COVID-19. Other people may have conjunctivitis, because from the nose, the virus can go through this special tube. It's a duct which connects the eye, the lacrimal glands, the tear glands with the nose. So the virus can travel from the nose to the eye here. And also, of course, the virus can come directly on the eye if somebody sneezes towards somebody else, and that person is with open eyes, or there are these micro droplets in the air, too much amount. Of course, when you keep the eyes open, the eyes can be contaminated too. So conjunctivitis is another symptom possible, or a sign. Mouth, it can be affected by the lack of taste. When the virus attacks the nerves of the tongue, then we cannot feel the taste. And this is one typical symptom of COVID-19 in comparison as a difference with the flu, because in the flu, we do not have this lack of taste. We have very seldom problems with the nose, like anosmia, and we do not have so sudden aggravation of the disease, and we do not have thrombosis and so on. There are some differences between the flu and COVID-19. I will speak about it a bit later. The virus can attack also the pharynx. When it attacks the pharynx here, we have like a sensation of sore throat, like a dry throat here in this part, with some pain, a bad feeling. So we can use big products here very easy, because we can reach this area very easy, like the nose and the mouth. We can use honey, propolis, royal jelly, and so on. Very, very easy to destroy the virus locally. When the virus enters into the bronchia, trachea and bronchia, then it can cause symptoms. One, the main sign is dry cough. Dry cough is when we are coughing, like I coughed before, but no expectoration, no mucus, no phlegm is coming out of the lungs. So this is also specific for COVID-19, but we can treat this dry cough, we'll see later, okay? Then another very, 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 I say again, very, very, very important mechanism of action to understand why the lungs must be helped to eliminate the virus is we need to look to this part of anatomy. We have here what is called a respiratory epithelium. You can go into Wikipedia and check more details on this. Epithelium is like an internal skin, like skin outside on the body, but also like skin in the mouth is called mucosa. In the lungs, also mucosa, respiratory mucosa. And this layer, which is in contact with this here on the air, inside it's called an epithelium or endothelium in the case of arteries. Now, look here carefully, and you'll see that these cells are having this special, like hair, if you want. These are called cilia. And here is the mucus. This bluish kind of color here all around is mucus. So all the cells in the lungs and also in the digestive system, also in the genital system, are in the nose and so on and so on. They are covered by a layer of mucus. And this mucus, when it's more or less fluid, it must not be too thick and not too watery. It can catch particles, like here. It can be smoke particles, like for smokers, smoke particles from the pollution from outside, or also it can be viruses or bacteria which enter into the lungs, okay? Now, why is so important what I'm explaining you here? If these cells are healthy, they can move like the waves in the ocean, and they can move these particles step by step upwards, and it goes from the lungs, it goes upwards to the pharynx, to the mouth, and then we spit out this mucus. And you know, the smokers in the morning, they spit out, they have this expectoration, this very, very dirty, very bad phlegm, which is blackish. As long as the lungs have still the power, these cilia have still the power to eliminate these particles. But if we smoke too much, or you have too much pollution, or these cells, they do not have enough energy, enough vitamins, enough antioxidants, and so on, they will get weak. And then these factors will affect all this anatomy here, all the structure, all these many cells which are present in this structure will be damaged. Then this goblet cell which are producing the mucus will not work properly, and the mucus produced by this cell, goblet cell, will be too less, too dry, it will become too thick, and then this action from inside out of the dirt from the lungs will go reversed. So, and this you can see often too in the case of smokers. They, because of the free radicals from the smoke, from nicotine and so on, these cells are paralyzed, and more or less paralyzed. So the mucus accumulates more and more into the lungs. So no more oxygen can enter. They get cancer, and they get many other diseases. Okay, so it is of paramount importance in the treatment of COVID-19 to make happy these cells with these hairs, these cilia, because they move out the mucus. Okay, so to make happy these cells, we need here honey, we need here propolis, because honey gives directly energy to these cells to move better, and propolis protects these cells against free radicals, against viruses, against bacteria, and so on, against oxidation. So honey and propolis through the nose, through the mouth, through these propoli devices I told you before from Italy, from Slovenia, or from other countries, but also inhalations with honey and propolis, and also nebulization with honey and propolis is very, very important. So if the cilia, this cells does not work properly, we get situations like this one. It's very, very dirty what I'm showing you, but this is the reality. People having chronic pulmonary diseases, they have situations like this. The pus, the mucus, the bad cells, the dead cells are accumulating, and of course they cannot breathe anymore. So at a smaller scale, it happens a similar thing in COVID-19 too. It's not the mucus which accumulates so fast usually, but it's the accumulation of water. And the mucus is also a bit thick, but seldom it comes to such level like in this image. But anyway, when it's too much such substances, then the lungs cannot absorb anymore the oxygen. Very, very old remedy against dry cough used all over the world for centuries is linden flowers, and ideally linden honey. But any honey or any plant that will have special mucus, vegetal mucus, like the linden flowers, they have special substances which are like mucus, very, very soft mucus. If you crush in between the teeth linden flowers, you'll feel this kind of mucus. It's like a gelatinous mucus, okay? So the combination of linden flower tea and this linden honey is very, very good, because it will help the lungs to eliminate the mucus easier. Honey is mucolytic, and this one makes a soft mucus which is easier to eliminate. Okay, if we do not have linden flowers, we can use olive oil in a propolis extract, like propolis extract plus olive oil, like this propolis here, Propolis in Romania, or extract, soft extract of propolis, and any kind of honey. So we can combine also these things together. There are also herbal remedies against the dry cough, like turmeric or like licorice, which is also, by the way, antiviral alone. And also we combine all these things, of course, with warm water, never cold water. Cold water is a very big enemy of the immune system, and everything which is cold favors viruses, bacteria, fungus, parasites, because diminishing the body temperature diminish the power of the immune system too. Okay, now another situation is a deeper problem when the virus goes very deep into the lungs through inhalation, strong inhalation, or it goes slowly from the nose, pharynx, larynx, trachea part. When it arrives to the alveoli here, this part, it will cause damages because it fixes to the alveoli, it enters into the alveoli, and it causes symptoms like dyspnea, which is lack of air, feeling that the air is not enough, chills, like we have, sensation that we are too cold, fever, myalgia, which is pains in the muscles, fatigue, loss of appetite, hemoptysis, viral pneumonia, which leads to microthrombosis in the lungs, and this leads to lack of oxygen. And the people are dying through this kind of mechanism, okay? So how to eliminate these symptoms one by one? Let's discuss some of them. Dyspnea, shortness of breath due to the lack of oxygen, okay? Lack of oxygen, okay? So what can we do with apitherapy? We can use, first of all, honey and propolis, because honey gives energy to the lungs. Propolis is anti-inflammatory directly. And also bee venom we can use outside on the skin to improve the blood flow. So we can use bee venom cream. There are many bee venom creams all over the world. I know very well Apitherapy because it's made in Romania. And we can apply on these acupuncture points. When we apply on these acupuncture points, we activate the blood flow, we activate the production of adrenaline, and adrenaline is bronchodilatory. This is very important. It dilates the bronchia, so more air can come into the lungs. Another good point is governing vessel 26, Zhenzhong, which is also stimulating the adrenaline production, which is also bronchodilatory and cardiostimulative too. It gives power to the heart. This point, Feng Qi, it's here on the back of the neck, gallbladder 20. It's also very good to improve the adrenaline production. Then we have lung 1 and lung 2. You have here the Chinese names of the points, which are like alarm points, which activate the functioning of the lungs too. Then you have conceptual vessel 17 here in this area, which improves the functionality of the whole lungs and the chest area too. We have also very, very good point. It's Heku here on the hand. And this is very good against laryngeal spasm. Sometimes in case of allergies, usually some people, they can get this laryngeal spasm. The large larynx gets spastic and the people can suffocate and die. At this point is very good for such a thing. Then you have urinary bladder 13, Fei Shu, which is here between the shoulder bladder. This acts also on the lungs. And this one, this point here, activates the adrenal glands. And remember that adrenal glands secrete cortisol, natural cortisol, which is anti-inflammatory, and adrenaline too, which helps the functioning of the blood vessels of the heart and so on. Other points, interesting points on the ears, we can activate all the points on the ears. There are over 250 points, micro points on the ears, and each of them are related to a certain organ. For example, the lungs and heart are here located. So you can put some bee venom cream in this part, and all over the ear it's also okay to activate all these points with the bee venom cream. Another method we discussed already, it's the nebulization with honey. No, we didn't discuss. Now we discussed. We need a nebulizer from the pharmacy. You see here this system. You put honey and propolis here, or just honey, and then you breathe in this kind of fog, which is coming from the device. So honey or propolis inside the nebulizer. When we have chills like chills, you see here in this image, the most important thing is to protect our body to lose heat. So we need these clothes very, very thick to protect the heat in our body. But also we need to drink a lot of warm fluids, warm water like 42, 43 degrees Celsius water, and also tea, soups, and so on and so on. Okay, fever which comes as a symptom, it's a sign also, because you can check it with devices, thermometers. Fever, it's one major sign, and which is very, very important in the healing of the coronavirus diseases. Muscle pains, fatigue, loss of appetite, but we can eliminate this bee pollen, royal jelly, honey, and lemon juice. And also, the loss of appetite comes usually when the liver is too intoxicated. If we have already viruses in the liver, or we ate before too much. So the trick here is to eat less amount of food, to eat that baby food I mentioned to you before, and then to get also bee pollen, royal jelly, honey, and lemon juice, which will help the liver to work properly, so the appetite can come back. Hemoptysis is when from the lungs, when the virus comes here and it damages the capillaries, it may cause bleeding into the alveoli, and this blood can come back here to the mouth, and we have this hemoptysis. But propolis is against hemorrhage, and honey can help too if we use it before, preventative, and we can use it also therapeutical. People having these things, we should put them immediately on propolizers and propostim and so on and so on. In case of viral pneumonia, when the viruses are all over the lungs, and there are specific signs for this viral pneumonia in case of COVID-19, we need all beehive products, and also we need medicinal plants. Microthrombosis in the lungs, we can eliminate it or neutralize it or diminish it at least with bee venom taken through the skin, oxymel, honey, organic acids. Capillary fragility, as I said already, is the main cause of aggravation in COVID-19. And you see also here one sign, people having this kind of under the skin like viruses, microviruses. This also, it's a sign of capillary fragility. Okay, when somebody gets a hit, a small trauma on the skin, and then it comes blue skin, very easy, it's a sign of capillary fragility too. Okay, so capillary fragility, lack of vitamin C and polyphenols, and diabetes and high blood pressure means a higher risk for hemorrhages, including stroke. So this correlates usually. Lack of vitamin C, capillary fragility, diabetes, and high blood pressure. And all these factors are getting problems. Now, in the bee products, in the honey and propolis especially, but also in bee bread and bee pollen, we have substances like camphorol and quercetin, which are having anti-inflammatory effect and prevents platelet aggregation. There are many such studies, which means that these substances, they can block the thrombus, the thrombosis in the blood vessels, in the capillaries, and then they can inhibit also the cascade of arachidonic acid, that cascade of cytokines. Okay. Other symptoms and signs, when the virus comes into the digestive system, when we swallow the virus, the body will react against it and will cause abdominal pain, but the most important thing, it will cause either vomiting, so we vomit, or you have diarrhea. Both vomiting and diarrhea are very good because they help us to eliminate the virus. So we should not fight the vomiting and diarrhea, only if the vomiting and diarrhea is too strong, and we get dehydration. But if it's less than 6 diarrheic stools a day, and it's not longer than 3 days, then we should allow the diarrhea to do its job. Diarrhea helps us to eliminate the virus, bacteria, toxins, and so on. Same is for vomiting. When we eat sometime bad food, we have naturally vomiting, but also we can stimulate the vomiting ourselves mechanically if we insert some 2 fingers into the back of the throat to stimulate the vomiting. Now, if the virus succeeds to go through all these barriers, through the nose, through the bronchi, through the lungs, through the capillaries, and arrived into the blood, directly inside the blood, it can attack the red blood cells, and then it can disrupt the connection between the hemoglobin, the globin and the hem, and the iron is released. This causes more ferritin levels in the blood, because ferritin is a molecule which carry the iron. And this is also related to microthrombosis, dyspnea, myalgia, fatigue, pale blue fingers and lips. Okay, so here the point I want to make is that even if the virus will destroy a certain number of red blood cells, and this it happens also when you get too much bee stings, like over 200, 300 bee stings, the melittin from venom can destroy also the red blood cells. But if the body can regenerate these red blood cells by producing them in the bone marrow, in the red bone marrow, then we can buy time for the immune system. The situation will be like a stalemate. It will be like a balance, like an equilibrium. And then, okay, let's say 100 red blood cells are destroyed by the virus, but other 100 red blood cells can be produced in the bone marrow. So we can have a balance, an equilibrium. And in this time, the immune system, like I said before, have time to prepare the strategy, to prepare the weapons, to start making the antibodies and so on. Okay, so we have many, many ways. Practically, we can use the Beehive products at all levels of the disease. From outside, when it enters into the nose, when it enters into the lungs, it enters into the arteries, it enters into the blood, into the heart, liver, kidneys, everywhere we can reach with Beehive products, these organs, and we can protect them. Okay? Okay, so I explained this. Inflammatory reaction, microvascular I explained. Okay, blood thickening and brain stroke. Now, one major cause of brain stroke is when the arterioles are too weak, they break too easy, or the blood inside is too thick. We have not enough serum, we do not have enough water, because we do not drink enough water. Then, of course, the blood will become thick, like you see here. The red blood cells, the white blood cells, the platelets will become too dense, and this may cause the rupture of the arterioles, of the walls of the arterioles or the capillaries. And this causes brain stroke, bleeding in the brain, okay, which is very dangerous. And this bleeding may be caused by the lack of vitamin C and the lack of polyphenols, because like in the capillary fragility, also the arterioles, if they do not have enough vitamin C and polyphenols, they break easier, okay? So again, this other symptom or problem which can come because of the virus, as I told you before, when the virus attaches and attacks this endothelium, it causes an endotheliitis, which is an inflammation of the internal part of the arteries. And there are several diseases which are related to endotheliitis. Okay, so in this situation, to prevent such a thing with Beehive products, we need to give to the patients, to the people before the disease, before the virus comes, we need to give them enough Beehive products. And these Beehive products must arrive to the arterial level. That is why, in case of COVID-19, it is not enough to take the bee products through the mouth, because most of them will be used into the liver, and a very, very small amount will arrive to the heart and the rest of the body. So that's why if we have acute disease, we need to take the Beehive products also through the lungs, through nebulization and the propolizing and so on, because when you take honey and propolis through the lungs, the bee products goes into the blood very, very quickly. Okay. Okay, I explain this. Flexibility. Okay. I can go faster. We discussed about these things. Again, the virus which attacks also may attack also the level of the myocardium. And now here is a general image with all the symptoms and signs, all main symptoms and signs caused by the virus itself. So, and for each of these problems, we have solutions. in apitherapy, in medicine, if we do carefully a good strategy, a good treatment protocol. Difference between the flu and the COVID-19. I told you about the loss of smell or taste, about this thrombosis, about the dry cough. And another factor which is a very clear difference between the classical flu and the COVID-19 is that COVID-19 comes mainly to the aged population, to aged people, and the flu, normal flu, it goes to all ages, from children, teenagers, adults, all ages are attacked by the normal flu. But the COVID-19 have a preference for the aged people. Okay, then the doctors, they need to do also differential diagnosis. Sometimes we are not sure that our lung problems are caused by viruses or by bacteria. So bacterial pneumonia gives a bit different kind of signs and symptoms, like tachycardia more often, but it can be also bradycardia. The breathing is very, very, how can I say, it's dramatic. Tachypnea, it's like breathing, it's more than 18 breathing per minute. Central cyanosis, like all the body, it's like blue skin, blue face. Altered mental status, it is more present than in the case of viral disease. And you have all these kind of symptoms which the doctors can check, and they can tell, okay, this is a bacterial pneumonia, or it's a bacterial complicated viral pneumonia. Like at the beginning can be the virus, and if the virus multiplying to the lungs, because it destroys the blood vessels there and the cells, these cells are dying, and they become a very good food for bacteria. So bacteria can come also after viruses, okay? So in this situation, you need to treat more complex, and even antibiotics, if they are chosen correctly, they can be useful. Okay, now more theory here. Integrative treatment is needed. And now let's speak a bit of role of heat and fever in the prevention and treatment of COVID-19. So heat and fever, it's like the scalpel in the hand of a surgeon. We know that all human beings from all the times, all over the world, when they get an infection, like the mammals, I said, they get a fever. Why is this? Because the fever allows many good things, activates the blood flow, improves the immune system, and it increases the chances of recovery and of healing. The only situation when you need to reduce the fever is when you have mental confusions, convulsions, exacerbated acute symptoms, or sepsis. And I strongly suggest you to go to this article in internet and to study this article, because it is light-giving. It's enlightening. It's a very, very good article. Because, and for me, the most important thing was that when I read the article, they found out that if you decrease the fever too soon, the animals of experiment, they die much more than when the fever is allowed to do its job. Okay, so there are mistakes, unfortunately, which are made in the hospitals where they treat the COVID-19, and these mistakes were done especially in the first months of COVID-19, when the doctors, they didn't know that it's a problem also of thrombosis, not only a problem of the lungs. So they used a lot of ventilators, and the ventilators, they blow air, and this blow of air, it's usually done with a pressure which is very difficult to regulate to be exactly the pressure the lungs can tolerate. When the pressure is a bit higher than the lung tolerate, then it's similar like when you have a balloon. Lungs are like a balloon, and you come with a needle like this one, it will explode. So having too much pressure in a viral situation, when you have the capillary fragility, the bleeding starting or being at the beginning of the like microbleeding, then you'll create more problems. And already statistics are saying that ventilators killed more people than it should have been. Okay, so fever is very important. Fever is our friend. And as I said, decreasing the fever too soon with chemical methods diminishes the effectiveness of the immune system. and allows bacteria and viruses to survive and can increase the risk of death. So theory, you can read it later too. About the Brownian movements, maybe remember from chemistry, fever or the physics increase the movements of the molecules, and this increases the fluidity of all semi-solid and liquid substances. Okay, good. So, and now here another factor why I am against the substances which are given against the fever, like Tylenol, Panadol, acetaminophen, paracetamol, ibuprofen, and so on. All these kind of chemical drugs, they destroy more or less the glutathione. And if you look into internet in Wikipedia on glutathione, you'll see that this is a very powerful intracellular antioxidant, and it helps the process of detoxification in the body. Less glutathione slows down the neutralization and injection of harmful substances and also the healing process. So we should not use, when we want to diminish the fever, chemical drugs. We should use physical methods, and I will explain later about this. Okay? And also the chemical remedies, because are made of chemical drugs, they make liver damage. So if they attacks the liver, even if the fever will be diminished, if we get liver damage, then we get other problems. Okay, so it's not logical to use chemical system. Okay, so we should use only physical methods. Here it's about this article I told you, that fever increases the survival rate, and if you block the fever, you decrease the survival rate. Okay, so again, when we should decrease the fever, when it's too much inflammation, when it's too much heat, too much fever, and it comes mental confusion or other neurological signs like convulsions, strong inflammation, sepsis. When this comes, then yes, we decrease the fever as fast as possible. Okay. Yesterday I made a presentation for the Western countries, and one of the participants was from Egypt, Professor Mamdouh Abdul Rahman. And he told us he's a professor of pediatrics in a big university, big hospital in Egypt, in Cairo. And he told us that the convulsion in the children especially comes only if the fever increases very fast, suddenly, like from 38 jumps very suddenly in minutes to 39. But a fever which grows slowly does not create normally convulsions. And anyway, the convulsions themselves, they are not life-threatening. The problem is if the heat is so big and it will start to coagulate the proteins in the brain, for example. But the coagulation of proteins, remember, happens when we have temperature over 45 degrees Celsius. And let's remember, many of us, we go to sauna. In the sauna, we can stay like 15 minutes, 30 minutes sometime at a temperature of 80 degrees Celsius. We do inhalations with hot water, like old style. This hot water is also, the vapors are like 80 degrees Celsius. So our proteins in our body are not so weak, so we can resist to this heat. And the fever, which is 38 degrees Celsius, is not 80 degrees Celsius. 38 degrees Celsius, it should not be a problem. So we need to keep it under control. Okay. Now, the fever, it's like related to inflammation. And when you have like a typical cause of inflammation, when you have an injury like with this thorn, inflammation is very, very good at the beginning because it allows the body to come here to block the invasor, to smoothen the tissue, and the thorn can be eliminated easier with some pus, some time. But the inflammation, it's a useful thing. The problem is when the inflammation is too strong, like you see here in this image. Too strong fire, the fire will destroy the dried wood here, which we want to destroy, to burn in our gardens. But if the fire is too strong, it will also burn the healthy herbs or plants which are around. Okay, so that's why fever, it's very, very good, but should not be too strong. So it's like a dance with the fever, it's our friend, also our enemy can be. But if we know how to use it, it's like the art of treatment, we can heal the people much faster. Too much heat, of course, is bad. Okay. I told you that we should diminish the fever when you have septicemia or sepsis, when microbes like from gangrene are going all over the body, and they are causing this kind of tissue damage. But if we use quickly enough honey, propolis, essential oils, we can block this gangrene, we can block the septicemia, we can regenerate the tissue. Okay. Now, what to do in case of fever also? If we want to, in the beginning, to increase the fever because it's useful, we will use enough warm fluids orally. We use thermal protection. We'll use warmed room, like 27, 28 degrees Celsius. And remember, there are countries like in Africa where the temperature in the room outside it's usually good. But there are also people which are staying in the cities in Africa and they use air conditioning. And air conditioning is very bad because it's only 18 degrees Celsius. Okay? And also to increase the good therapeutical fever, we need baby food and a lot of bee products. Okay. Okay. Now some general rules for the prevention and treatment of the COVID-19: improving the immune system, keeping down the comorbidities, blocking the mechanism of action of the virus, having a nutrition which has all kind of vitamins, enzymes, zinc, and so on and so on. Using aromatherapy as antiviral is also a very good idea because there are many essential oils which are antiviral. Psychotherapy to sleep better, meditation, Qigong, Tai Chi Chuan, Pranayama, vitamin C at least 3,000 milligram a day, vitamin D3 like 6,000 units per day, zinc, selene, all these things are very, very important as antioxidants. Okay, and then also a bit of theory, you can study later at home. The cells from the immune system, they have different functions. They need all kinds of things to function properly. I go faster on this. Again, this concept that all the organs participate to help the functioning of one cell, and each cell helps the functioning of all the other cells in the body. Okay, same is for the immune system. Immune system cannot be healthy if the liver or the kidney or the lungs, the pancreas or the heart is not functioning properly. So, and also in the same time, the immune system protects these organs if it's healthy enough. Okay. The D'Artagnan principle, you know, one for all and all for one. Each cell of the body, it's like body cell principle. I work for you all of you must work for me too. Like the D'Artagnan, you remember that novel from Dumas in France. Okay, so each cell, tissue and organ system in order to function properly need non-stop, simultaneous, all these categories of things. And you must check with the patient if it has a good nutrition, enough oxygen, enough protection against other bacteria or viruses or fungus, if it has a good hygiene outside the skin, but also internal hygiene, like no constipation, if it drinks enough water, if it sleeps good, if the cell division is done well, like the regeneration of the skin and the mucosa is done well, and also if it's enough good blood flow, enough energy, not too much, not too less, and if it does exercise activity, it has good information, good coordination. Information means less stress. Okay. Nutrition during COVID-19, baby food. I show you some images here. Raw egg yolk, like this one, from the quail's eggs, from the chicken. Pollen, it's a major nutrient during COVID-19. Bee bread, honey, peas, and so on. Soaked seeds, very, very important for a baby food because they give excellent nutrients in very fast time with very, very small amount of loss of energy. Each kind of seed needs a different time to open, and you find in internet such slides with how many hours are needed to open different kind of seeds. Fish is very easy to digest, so yogurt and kefir very easy to digest, and brings also lactobacills, which are important for the immune system, are as probiotic. And also again this image with the non-ripe honey. Here ripe honey, mature honey. Here non-ripe has more water, more lactobacillus, like in the yogurt and kefir, and not such a kind of food. So vegetarian diet with enough heat, vitamins, B products is much better to heal COVID-19 or prevent it. Such a food increases acidity in the body, blocks the blood flow, creates too much mucus, and favors viruses and bacteria and parasites and fungus. Okay. Another image here, foods that create mucus, like this one. Ice cream, bread, which is from white flour, the dairy products, cheese, milk, bananas also, they can create mucus if it is taken too much. This kind of food like chips and all kind of this kind of processed food, cakes, fried potatoes, and so on. These kind of foods, and we can add to this kind of foods honey. Our honey is very good to eliminate the mucus. Honey is mucolytic. It cuts the mucus, the thick mucus, and it makes it more fluid, and it can easier go outside the body. About doses. The doses generally, I can give you a general concept here. You go from 0 when the people have allergies or intolerance to a certain bee product, but you should go to as high as possible dose. Here is like honey, 1 milliliter per kilogram body weight per day. If this man has, for example, 80 kilograms, it needs 80 milliliter of honey a day. So which may look like a big amount, but if you take it with enough water, it's very, very good, and the honey is well tolerated by the body. Also, honey to honey, same kind of doses. Honey, it's good to give to the honey also spicy foods, because the spicy foods like these ones, they help the immune system. They increase the heat in the body. And also onions are rich in quercetin. Remember I showed before, quercetin blocks the ACE2 receptors, and it's also anti-inflammation. It's diminish the histamine, diminish the cytokine cascade. Okay, magnesium, 325 enzymes in our body needs magnesium. So where to find magnesium? In rose hip, in pollen, in cacao, soaked sunflower seeds, broccoli, spinach, and so on. So here you have a recipe with magnesium, rich in magnesium. So this is also an image. So avocado, pollen, bee bread, cacao is very rich in magnesium. Banana, small amount, it's okay if we don't have wet coughing. Rose hips are very rich in magnesium too. So we can also take foods rich in enzymes. Remember that enzymes are very important for regeneration of the damaged cell and tissues, and also against the inflammation. So honeybee pollen, soaked sprouted seeds, and so on. Organic acids. This is very interesting. Remember that the people getting complications in COVID-19 is because they get thrombus. But these organic acids, which are soft acids, strong acids are like sulfuric acids or chlorhydric acid, but the soft acids like citric acid from lemon juice, malic acid from apples, gluconic acid from honey, and so on and so on, they fluidify the blood, they fluidify the lymph, and they help the regeneration of the damaged cells. Okay, so here you have one article about the vinegar, acetic acid in aged vinegar is against the thrombus disease. So it's thrombolytic. We know that the doctors, they use in the hospitals thrombolytic substances like coumarin and so on, heparin, but we can use natural organic acids like acetic acid, formic acid, and so on and so on. We show fibrinolytic activity. This is very important. The thrombus can be made only if it's enough fibrin accumulated there, but we can diminish this fibrin by using organic acids in the first phases of the disease. Okay, beehive products containing honey, honey vinegar, bee bread, even propolis has acids, organic acids inside. So honey itself is acidic. Okay, so it's good to have honey plus and bee products with this kind of foods because they have these organic acids and they make a more fluid blood and they act against the thrombosis. And remember, the thrombosis is the one which kills mainly the patients with COVID-19, because thrombosis leads to hypoxia, lack of oxygen. Okay. How to administer the honey in COVID-19? We should administer practically through all anatomical ways, through the nose, gargling in the throat, very important for this, all style inhalations, nebulization, even intravenous, like the method which is reactivated by Professor Mamdouh Abdul Rahman from Egypt. So in the hospitals, instead of making the glucose intravenous, they could use honey, microfiltered honey if it's necessary, and then administer in the veins, because it will bring much more energy to the patient, which are so weakened by the disease. Also, classical administration of honey, orally, sublingual, intrarectal, like suppositories with honey, propolis, beeswax, intravaginal for ladies on the skin, like honey massage, honey stimulating massage to warm up the skin. And also we can put cataplasma honey on the skin. Also propolis, 520 grams a day in raw form. We can chew it, or we can keep it in the mouth like a bonbon. And then we can swallow. There are European kind of propolis like from the poplars. And also there are like from Baccharis dracunculifolia, the green propolis from Brazil, which is also very spicy. Red propolis from Brazil too. There are many types of propolis in Taiwan, in Cuba. Every country has different types of propolis, but all of them are antibacterial. And many of them which have been already studied, they are also antiviral. Okay, so propolis again can be administered through all anatomical ways, like for the honey. Here you see also the same kind of administration, but in forms of propolis creams, tinctures, tablets, and so on and so on. And here it's the beeswax, a very interesting use of beeswax, not only against the hay fever, like we know in apitherapy or for the low back pain, but also because honey can absorb a lot of heat, and this heat can be transferred to the tissues which are affected by the COVID-19. So we can put such a thing not only on the back, we can put it also in the front of the chest here. Here I put it in China. I was last year on my shoulder. It was more practical. So it's a beeswax plus propolis. That's why it's blackish, and it's heated in a microwave oven to about 55 degrees Celsius. And then you put on top of this cataplasm with beeswax and propolis, you put this kind of special device which creates extra heat. It's an electrical heat. Okay, so this heat from the device and from the beeswax which is heated, then it has time to go deep into the body. And I was amazed when I received this kind of treatment. After I took out both the beeswax and propolis and this device, the heat in my bones, deep in the bones, in the muscles, was at least for other 30 minutes. So imagine we can use this kind of system when the people get the first symptoms of COVID-19 in the lungs, and will help them because the heat, remember, destroys the virus, damages these spike proteins, the enzymes from the virus, and also activates, very, very important, the local immune system. Okay, now beeswax can be administered also through wax cappings, like chewing gum on the skin, as I said, and so on. Now, beehive air as a spa, preventative and treatment method. The beehive has inside a lot of volatile substances. We know that if we breathe the air near a beehive in summer, it smells so wonderful. And many of these volatile substances are useful for the lungs. That is why they found out in Austria too that they can treat a lot of diseases of the lungs, like hay fever, but also bronchitis, asthma, and so on, by inhaling the air. Now in Germany, the top device is made by this gentleman, Jürgen Schmidgen, which makes this kind of device, which is really very, very good. It has the best technology. And you do like 1 to 2 sessions a day, 15 to 20 minutes. And it can be preventative in case of COVID-19 too, because the volatiles from the beehive goes directly into the lungs. And here is the thing. Normally, if you take honey or propolis and you swallow, you need big amounts because this honey and propolis will be diluted all over the body. So very small amounts will arrive through the blood to the lungs. But if you inhale the volatile substances from propolis and beeswax and honey, even small amounts of these substances will arrive to the lungs. And remember, I showed you those slides with the respiratory epitheliums, with the cilia. So even small amounts of substances can heal. Royal jelly. You need to give as much as possible, like 2-5 milliliter every 2 hours, even 12 times per day, every hour when it's a complicated phase, acute phase of COVID-19. And you should give it under the tongue. And there are cases in Germany, I know from Mr. Arno Bruder, also from Professor Eberhard Bench many years ago. He told us, and also I know from Romania, cases of viral diseases which have been cured only by royal jelly separately. Royal jelly is also antiviral. Okay, so you take even 25 grams a day of royal jelly, or even 30 grams a day, or even 40 grams a day of royal jelly. But remember, small doses many times, like 2-5 milliliter every hour. So not all 50 milliliter of royal jelly once, because it will cause, of course, problems. It is a very powerful product. But if you split it in many, many smaller doses, and you give time and you take enough water, then it's okay for the body can absorb it. Here we have Apilarnil, the drone larvae. Drone larvae are very rich in stem cells and a lot of micronutrients. So you can take it also 2-3 milliliter up to 6 times per day. Keep it under the tongue first before you swallow, yes? Bee pollen, up to 1 kilogram body weight per day, like in the case of honey. Is very rich in polyphenols, very rich in vitamins, very rich in enzymes, in essential amino acids for regeneration. So whenever you hear that regeneration is needed, think to bee pollen. Bee bread, same thing. Okay, what is bee bread? You have here a smaller explanation for the people who doesn't know what is bee bread. Bee venom, we can use it also on acupuncture points, on the skin. We know that melittin from bee venom destroys all these kind of viruses, including HIV. Okay, you have the literature here. Now a few words why propolis is so important in the COVID-19. Again, theory about propolis. I'll go very fast. Substances from propolis. Properties. There are over 70 properties useful in propolis. And if we take only one of them, antioxidant, it's already fantastic to use it in this COVID-19. But it's also good inflammation. We know inflammation. We discussed about the free radicals a bit, excessive heat, which can be blocked by propolis. Remember that the buds of the trees or the bark of the trees, they stay under sunshine, under the sun, like for example in Australia where it's very hot, or Arabic countries. And the plants, they are covering the buds with these special layers of polyphenols, which protects against the sunlight, against the heat. So also there are such substances, polyphenols, inside the plant themselves. So propolis is like a very good remedy against the heat itself. I go fast here. We discussed about the theories. Honey gives fast energy also to the white blood cells inside the body. Oxygen is very important for the mitochondria. It must reach into the cells. Okay, and the bee products helps the mitochondria also inside. It's a longer way, but the idea is that oxygen comes to the cells because we give, for example, pollen for the muscles of the respiratory muscles to allow us to breathe, muscles of the heart to pump the blood, and also the venom activates this blood flow. Royal jelly helps the regeneration of the red blood cells, and red blood cells can transport oxygen better. And propolis helps the lungs themselves. Propolis dries the lungs. You remember the worst enemy of the lung is water. When we get drowning, or you hear about people which drowned in water, too much water in the lung is very bad. And when COVID-19 is in advanced stages, it causes such excessive liquid in the lungs. But propolis, generally speaking, is diuretic. it diminishes the capillary permeability. So we can say like its physical characteristic, it helps the dryness. And propolis also opens the bronchia, and it has many simultaneous properties which are useful for the lungs. Okay, what is a mitochondrion? Mitochondrion, it's that part in the cells which creates the energy. And the mitochondrion gets the glucose, for example, from honey, and then the oxygen, and with glucose and oxygen, it creates a lot of energy. Now, there is a study done in Lithuania which show that even if we have low amount of oxygen, but if we have enough propolis, enough polyphenols, these polyphenols will help the mitochondria to survive longer, to resist to this stress. So even if the patient sometimes they have hypoxia, they have this lack of breath, they have shortness of breath, and they feel like suffocating, if you give them enough propolis, enough honey, they can resist longer to hypoxia. Remember that the most sensitive organ which needs oxygen, it's the brain. The brain gets in big problems if we block completely the administration of oxygen, like when we are drowning. But the brain can still survive if it has a minimum amount of oxygen. And the rest of the body, like the muscles, for example, they can resist even 12 hours with complete lack of oxygen. No oxygen at all. The tissues in the rest of the body can survive a lot of hours. So the brain is more sensitive. But if we act quickly and we give all this honey and propolis and the bee products, we'll allow the cells to survive longer. Okay, good. So we discussed about the heat, essential amino acids, enzymes, and so on. It's good to remember that the cells in the body which kills directly the viruses and the bacteria are usually macrophages and neutrophils, and they use free radicals and special enzymes to kill them. And just a few drawings here, a few images. This is called phagocytosis, when a lymphocyte, a macrophage or a neutrophil, like here, comes and eat a virus, and then destroys the virus inside with special enzymes and also with free radicals. Now, the problem is that if the leukocytes, the white blood cell itself, does not have enough antioxidants inside, not enough vitamin C, not enough propolis, not enough polyphenols, vitamin E, selene, zinc, and so on, beta-carotene, the excess of free radicals, possible excess of free radicals, will destroy the cell itself. Okay? So the white blood cells needs huge amounts of essential amino acids, of minerals, but also of antioxidants. That is why the beekeepers which are taking regularly honey and propolis, they have more antioxidants in the body, and they do not get COVID-19, but extremely seldom. No antioxidants, no proper functioning of the immune system. Propolis is also antimicrobial, you know already. Propolis is antiviral, antiherpetic, antimycotic, antiparasitic. In Africa, in Indonesia, I know studies about use of propolis against malaria. Many studies have been done on Giardia lamblia, Trichomonas vaginalis many years ago. Propolis is anti-inflammatory, a cicatrizing agent. Like this lady used propolis. It was a big trauma here on the face with 3 wounds. And in less than 2 weeks, in 13 days to be exactly, she was completely regenerated. So she went through inflammation, through destruction of the cells and so on, only 2 weeks. Propolis improves the overall blood fluidity. Substances from propolis, also to give you some more theoretical part, quercetin, which has this structure, is antiviral, strengthens the capillaries. Remember, this is very important. It's also antitumoral. And you have here a theory about how quercetin helps the body, prevents the ACE2 binding with the virus. Okay. I go fast because I'll give you this presentation later. Okay. You see, then this is only for quercetin. If you'll have the patience to go in internet, or patient to go in internet to study all the other 299 substances from propolis, you may reach to hundreds, thousands of such studies which proves that propolis is very, very good. Pinosembrin, another substance from propolis, antibacterial, antifungal, local analgesic in case of pain. Galangin, caffeic acid phenetyl ester, caffeic acid, and so on and so on. Indications, uses, all kind of diseases, parodontosis, you know that propolis can, I know from other studies, including in Romania, propolis can block the parodontosis, but in at least 60% of the cases when it's used correctly. Capillary fragility, gum bleeding, we discussed about this. Okay, hemoptysia, sepsis, gangrenes can be reversed by propolis and honey. Respiratory masks with propolis. This I learned from this lady from Ecuador, Sandra Mercado, which is a therapist there, and she used masks, and we can put propolis inside the masks. And I put this in Facebook, and then many people took this idea and they improved it. Sandra Mercado said that it's good to have these masks and then to use this Valsalva method, which is to blow the air through the nose but blocking the nostrils. So the air will go back into the lungs. So this is one method at the beginning of the COVID-19 when there are no symptoms in the lungs, because you can make the propolis substances to come deeper into the lungs. There are many parts of the lungs which are not well ventilated when we breathe slower or you have asthma. So this method is like blowing into a balloon. It will allow more volatiles to come into the lungs. But again, do not do this when it's already inflammation in the lungs, because the capillaries are already broken, and increasing the pressure is not a good idea. So just the very first stage of the disease. Improvement of this idea from Ecuador, you can put even inside the sachet like this one, raw propolis, which is very good quality. Or another very good idea from Professor Mamdouh from Egypt, you can put inside the mask here in a plastic sachet with some holes, many, many small holes, raw propolis, which is very fresh, which is very perfumed. Contraindications of propolis, allergy, intolerance. These are the main contraindications of propolis. And sometimes, because I remember all B products, they increase the fluidity of the blood. If the patient arrives to anticoagulants, this may make the blood too thin. So you need to check the level of coagulation in the blood with frequent analysis, like 1 to 2 times per day. And if the blood coagulation is good, then you can keep also the B products. Ideally is to diminish the anticoagulants and use more propolis, because propolis has more properties, useful properties. Also, propolis can decrease the blood pressure. So if somebody has low blood pressure, propolis is contraindicated, because propolis relaxes the muscles and it's antispastic. So this may decrease the blood pressure. So you need to take the blood pressure to the patient before. And also another contraindication, very seldom when people get transplanted organs, because propolis is immune stimulating. It's also immune modulating, but the component which is immune stimulating may aggravate the situation, because the immune system of the receiver of the organ will attack the transplanted organ. Okay, administration methods of propolis, we already saw through all anatomical ways. So keep in mind for all B products in COVID-19, because the virus attacks all the parts of the body. Remember, it attacks the nose, the mouth, the throat, the brain, the larynx, the bronchi, the lungs, can go to the kidneys, to the liver, to the heart, blood vessels, muscles, causing myalgia. So practically, if the virus is aggressive or it multiplies so much, or the immune system is so weak, it can go everywhere. So we need to go also everywhere with our B products. And remember, if we use only the oral administration, and I saw some apitherapists in some countries, they say just take honey and propolis through the mouth, 2 grams a day of this, 2 grams of this. This is not enough, because you need to go all over the body. So you need also suppositories for the ladies, vaginal suppositories. You need to use the inhalations of propolis and honey. You need to put on the skin the honey, put cataplasma on the skin, put beeswax to transfer the heat. So all possible entrances into the body, including the acupuncture points. Okay, so better because COVID-19 is a disease with very potentially very dangerous outcome, and because sometimes the evolution of the disease is very fast, I recommend to use not this approach. This is for chronic disease. This is maybe good for healthy or asymptomatic people to increase gradually the dose, but for the acute situation, for dangerous situations, or for the people which you already know, they have diabetes, they have blood pressure and some problems, so they have comorbidities. So probably if they'll get the virus, they'll get a fast evolution, a fast worsening. So in this situation, you should also go if the dose is high and fast, not half a gram of honey a day. You go as fast as possible to as high as possible doses of all bee products. Okay, so we discussed about this. Water propolis extract, nasal drops of propolis also you can use. And here you can be very creative. You can buy devices like this one, and you can put your solution, honey propolis physiological serum, as nasal spray or for nebulizations, throat spray, liquids, and so on. So toothpaste with honey and propolis from New Zealand. I have it in my own bathroom, this toothpaste. And all kind of administration methods and all kind of products. Even for the eyes, for conjunctivitis, we can use royal jelly, propolis, or honey, diluted to 2% to 3%, and then that special liquid which is good for the eyes, like the tears solution. And then you can microfilter it, and you can use it also as eye drops. Okay. Now this idea with the propolis having a lot of different substances in comparison with antibiotic, which is only one molecule. And same is for antivirals, because antivirals are based also on one molecule principle. And when you use only one molecule, you cannot destroy all enemies, because remember, in the body, let's say one kind of virus like here acyclovir destroy the herpes virus partially, but it will not destroy all the other viruses. But if we use a lot of substances like here, which have different actions against the virus, we may destroy many other viruses and bacteria, not only one of them. Okay, so the complexity of the honey and propolis here, propolis preparations, water, alcohol, oil extract, which you can do in your own laboratory. pH value, by the way, here, the pH of propolis is a bit acidic, between 5.2 to 5.7. So it's a bit acidic, and propolis is more antibacterial, more antiviral when it is in this acidic phase. So high acidity in the body is not good. I told you, because when we eat too much meat. But propolis, to be effective, it must be a bit acidic. That is why propolis, if you put in honey, which is also acidic, and you add some lemon juice, it's a good idea. And you should not give propolis in milk for children or for adults, because milk is alkaline, and it will decrease the acidity and will block the acids from propolis, which are antiviral. Okay, so different kind of preparations and products. So I'll go quickly through this one, because you can study at home. Okay, many different products with propolis. Coronavirus manipulated in laboratories. There is this Professor Montagnier, Luc Montagnier, who got Nobel Prize because he discovered the HIV, which is the cause of AIDS. And he said that in the laboratory, most probably this virus was genetically engineered, and it got some parts of the HIV. But it's not so dangerous, because clearly coronavirus is not so dangerous like HIV. But even if it's HIV here, remember, melittin can destroy the HIV virus. So conclusion to all this long presentation, all bee products helps the cells, helps the immune system. You need to take all of them. Getting COVID-19 is not a death sentence, it's a myth. And we should not fall under the fall of the mass media, which tries to make us fear. Of course, there are people who are dying, but not so much like they want us to believe. Bibliography on apivirology against this this website. You can also later on, if you want to deepen this problem with the COVID-19, but also to learn many more things on how to treat diseases with Beehive products, you are welcome to join us in our apitherapy.com in our courses. And you have my website and my email here. And I am located in Europe, for those ones who doesn't know, in Romania. This is the paradise country for apitherapy near the Black Sea coast. So Romania, here is Bucharest, the capital city of Romania. And we live near Bucharest in a wonderful area surrounded by forests. And we have there is a clinic. This is my house, my bee house here attached to the human house. And bees are here inside this area. We have a lot of green fields around with a lot of plants. This is my office. And this is the place where you can stay if you come for practical courses, once the air travels will be allowed. And thank you very, very, very much for your attention to this very, very long presentation. Okay. Oh, you are still here. Very good. I thought that you left. Okay, very good. So it was like 2 hours and 15 minutes presentation, but the topic is so complex, and that is why I took this time to explain it to you. And I hope you understood better some concepts. Many of you saw this presentation in the past, but each time when we look, we learn new things. So now please tell me all your comments. And by the way, one other thing, this PowerPoint, although I'm working on this PowerPoint for over 4 or 5 months, it is by no means perfect. You may find mistakes, or you may find some things which are not okay in the PowerPoint. Please send me your feedback, send me your email with the corrections or critics or other new ideas, new information to help me to improve this PowerPoint. So questions, my friends, or comments? Oh yeah, thank you from Anna. Anna from Poland, she just gave me by chat. She said, very good presentation. Thank you, Anna. By the way, Anna is organizing in Poland in September an international conference on apitherapy, and it will be an online conference. So I will announce all of you, and Anna will announce all of you to participate to this conference. Okay, good. Questions or comments on my presentation or new ideas? Yes? Who wants to put a question? Please raise your hand, or you have also a button there to raise the hand. Okay. Okay. Nobody wants to put a question, or I must. Okay. Oh yes. Mr. Jagadish. Okay. Yes.
Yeah, can you hear me, please?
Yes. Now I can hear you. Yes.
Okay. Thank you very much for your excellent deliberation
Yes.
on the topic, and we have had very good knowledge on this. But still, I have some queries about melittin.
Yes.
Is it possible that we could extract some kind of injection-like materials out of melittin, which could be
Yes.
concentrated and injected?
Yes. There are. Yes. Yes. There are.
Another question is that
Yes.
actually,
Yes.
what would be the legitimacy or medical recognition of this api product use in case of coronavirus, COVID-19? That's 2 queries from my side. Thank you very much.
Yes. Yes. Okay. Melittin, it's a peptide of 26 amino acids, and it's used extensively in research on the cells. If you look into PubMed or other databases, you'll see over 3,000 studies where they use melittin as a tool. So this tool is like a knife. It can cut through the cells, and then they can look inside the cells, or it can cut certain proteins and then also they can look there. So melittin is very powerful. Now, there are laboratories which can extract the melittin from the bee venom, or they can produce synthetically, artificially, the melittin, but it's extremely expensive. You'll not believe how much it costs 1 gram of melittin. 1 gram of melittin costs at least 7,000 euro. 7,000 euro, 1 gram of melittin. Of course, you do not need 1 gram in scientific research, but for us in the treatments, we need large amounts. So melittin, you cannot buy it. It's too expensive. Okay. Legitimation, your second question was, of course, if you look to the scientific literature and you see over 100 studies that bee products are good against viruses, or at least that it improves the immune system, at least that it diminishes the comorbidities, all health departments in the world, they should promote the use of bee products. If you look to the beekeepers, they do not get COVID-19, very, very, very seldom. A few deaths all over the world. So if you are a politician, if you are a leader of health department, you should ask the beekeepers to help you in the strategy against COVID-19. Now, there are some studies, they want to start some clinical studies on propolis, on honey against COVID-19, but clinical study, according to the pharma industry rules, it is very expensive. It costs like over $100,000. Needs good researchers, and it takes a lot of time. It's like you need 1 year of study. But nowadays the people are dying all over the planet. So in my opinion, to make clinical studies is good for the science, for our argumentation, but it's a huge loss of time, of precious time, because there are still people all over the world which are dying of COVID-19, and they should not die because they can survive if they use the bee products. So I have 100 different reasons why propolis, honey, royal jelly, and so on is good against COVID-19. Why do I need to reinvent the wheel of the cars? It's already done there. I have thousands of studies which shows that propolis is anti-inflammatory, is antiviral, is immune modulator, is immune stimulating. It blocks the capillary fragility. And I continue for hours. Why do I need another study 1 year to approve apitherapy? So if you have courageous politicians, courageous governments, like in Madagascar, or like partially in China, where they use medicinal plants, very well, or they use other natural remedies, then it's wonderful. But you should press the politicians. You have this database now, this information. I like to empower you. I can help you in the future too. So you can print on paper all this presentation I'll give you by email. You print on paper all the scientific studies you have in my website, and you'll get something like this, like a booklet with scientific studies. And then you should go to your politicians, go to your governors, go to your health department, and you go nicely, sweet, with a jar of honey, and tell them that honey is sweet, and also the bees can save the world. Okay, other questions? Yes, who wants to put a question, please raise the hand, and I'll open you the microphone. Yes, Mohammed, yes, Mohammed Salan, yes?
Yes, thank you, Stefan.
Yes?
We met in Turkey in Apimondia last time. Okay. My question is about the steam, propolis steam. Could you have
yes?
the formulation how to extract the propolis? Because my study now is we using molecular docking. It is very good for propolis to block the coronavirus from the spike protein. They can block in the AC2, And but however, if we using orally, it's not it's a long pathway from
Yes.
oral to the lung.
Yes.
But I think it's good by using inhalation. So, but I don't know how to make a formulation for the steam, a Propolis steam.
Okay.
Thank you.
Okay. Okay. So, first of all, you need very good beekeepers in your area to get you very fresh propolis. Okay, very fresh propolis. If you do not have in your area, you can import it from countries where propolis is collected by many years, for many years. For example, Bulgaria, Romania, Canada, New Zealand, they have big amounts of propolis. Also from China, there are areas, very clean areas, like in northeastern part of China, where they have a very clean propolis. Okay, this is first thing. Then you have two options. One option, like they used in Italy with these propolizers, and remember in the presentation, the name was Propolair, those devices like cones. They eliminate the beeswax from propolis to have more concentrated volatile components from propolis, because beeswax, it's like an excipient, which is diluting the propolis. So beeswax is also good as a heat resource, but for the treatment, beeswax is not so important, okay? How to eliminate the wax from the propolis? Very easy. You just put the raw propolis in water, then in a water bath, and you heat the propolis to about 55, 60, 65 degrees Celsius. And we know that beeswax becomes fluid at 62 degrees Celsius. So, but propolis itself becomes fluid at 82 degrees Celsius. Okay, so what will happen if you put the raw propolis in the water bath, ideally with ultrasounds device, then the beeswax will separate as a liquid from the propolis and it will come out on top of the propolis, then it will float in the water. Okay, so this beeswax, you can take it out, but this beeswax you should not throw away, because this beeswax is also rich in polyphenols because it stayed inside the propolis. So this beeswax is good to use in creams, in cosmetic creams or cream for the nose and so on. But again, this beeswax is not so rich, of course, like the propolis itself, okay? So this is the purified propolis with the Italian method, and also many beekeepers all over the world, they use this method to separate the wax. Now, one small problem with the Propolair from Italy is that the amount of propolis in these devices, which is on top of the device, is very small. It's maybe 1 gram, something like this. So it will propolize the air in the room, but in some cases, it may be not enough amount of volatiles in the room. So that is why, like you saw in Romania, that lady, which makes a small cabin, and you put many such devices to have enough concentration in the air. The other option is to use, like from Slovenia, the device which is Proposteam. And in the Proposteam, the advantage is that you can use raw propolis. You put directly the raw propolis. So you do not need to separate the wax. Okay? So you put the raw propolis there. And of course, you can put first some beeswax on this special shell. The wax will become liquid. And then you put the raw propolis, and this will perfume the room much stronger than the Italian system, okay? So you can combine both methods. You can buy both of them. You can use the Propolair for the cars in the cars, or you put more in the room, or you can use Proposteam. Each device has advantages and disadvantages, okay? Yes, okay, welcome. Anybody else for a question who wants to put a question, please raise the hand. Oh, yes, I see here Hempoon. Yes, yes, Hempoon, your question, or your child has a question? You do not hear. Okay, so, oh yeah, unmute. I said unmute. Okay. Question? Any question? Okay, lower hand. Okay. Other questions from other colleagues? Nobody has questions. Please raise your hand or push on that button which is like a raised hand. Huh? No questions? No questions. Okay. So we can finish our presentation. Okay, or maybe I will unmute you all. Maybe you cannot. Yes. Oh yeah, I put. Okay. Oh yeah, I see one hand here. So mute all. Allow participants to unmute themselves. Okay. Okay. Yes. I saw one question from Budi. Yes.
Yes, this is Stephen. Good morning from Nepal.
Good morning. Good morning, Budi. Yes.
So, yes, I'm okay. So, I don't have any questions myself, but you could see so many questions are there in the chat box. So, will you
Oh,
mind there, please?
oh yeah, I didn't look. Okay. 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 Good.
That's all. Thank you.
Yes. Okay. Okay. Let's then go to the chat area. Yes. Okay. Okay. Let me increase here. Okay. Go from up to down. Okay. Good. 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 Hello. 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 So I told you the presentation, you must send me an email to my email address because by recording this part of the chat is usually not recorded. So I cannot find your email address. And by the way, another thing I forgot to ask you, I would like to put this presentation in YouTube. So some of your faces will come also in YouTube. So if you do not allow me to put the presentation in YouTube, I will not put. But I hope you have nothing against this idea, because if we put it in YouTube, more people from all over the world will see that Apitherapy is a good method. So do you agree to put the presentation in YouTube? Please raise your hands. Who agrees to put in YouTube? Okay. Okay, I look also here. Okay. I hope it will be approved by everybody. Okay. Okay, good, good, good. Understood. Okay, okay. I go to next. Okay. 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 The recording, yes, the recording itself, a question from Mona Youssef. After Reza will record it, we can send you also the recording. Now, for you, Reza, one message. Maybe it's better to stop the recording now, and then you take a break, and then you click again on recording to have two parts. Because if the file is too long, maybe you will not be able to publish it in YouTube.
Okay, I started.
Okay. Very good.